You have been told your entire life to drink more water, 8 glasses a day, stay hydrated. Water is life, and all of that is true. But here is what nobody told you, and what changes everything after the age of 60. Plain water on its own is one of the least efficient ways to hydrate the aging body. Not because water is bad, but because after 60, the way your body absorbs and distributes water changes in ways that most people and most doctors never discuss. When you drink plain water, a significant portion of it passes through your digestive system and into your bloodstream without carrying the electrolytes your blood vessels need to pull that water into your tissues. Your cells stay partially dehydrated even when you are drinking what feels like plenty of water, and partially dehydrated blood is thicker, slower-moving blood. Blood that struggles to push through the smaller vessels of your legs, your hands, your brain, and your heart. The result is poor circulation, cold extremities, brain fog, fatigue that no amount of water seems to fix. But there is one simple addition, one ingredient that costs almost nothing, that you probably already have in your kitchen, that transforms plain water into a powerful blood flow booster. Something that changes how your body absorbs water at a cellular level, thins your blood naturally, and activates the circulation in your blood vessels within minutes of drinking it. My name is Dr. Michael Kent. I have spent over 20 years in medicine focused on senior health, and today I am going to show you exactly what that one trick is, why it works, and how to use it correctly. Because most people who try it make one small mistake that reduces its effectiveness by more than half. Stay with me, because after this video, you will never look at a glass of water the same way again. Before we go any further, if you are watching this and you are not yet subscribed to this channel, please take 2 seconds right now and hit that subscribe button and tap the bell icon. I post new senior health videos every single week. Videos that give you the honest, research-based information your doctor may never have time to explain in a 10-minute appointment. You do not want to miss what is coming next. Subscribe now, then let us get into this. Before I reveal the one ingredient, I need to make sure you understand what is actually happening inside your blood and blood vessels after 60, because this is not common knowledge, and once you understand it, everything I am going to tell you will make immediate and complete sense. Your blood is not simply red liquid moving through tubes. It is a complex living fluid made up of plasma, red blood cells, white blood cells, platelets, proteins, electrolytes, and dozens of other compounds, all of which must remain in precise balance for your circulatory system to function properly. One of the most important and least discussed properties of blood is its viscosity, how thick or thin it is, how easily it flows. Young blood, healthy, well-hydrated blood in a person in their 30s or 40s has a viscosity that allows it to flow smoothly and rapidly through vessels of all sizes, including the smallest capillaries that supply blood to the extremities, the skin, and the tiny vessels that feed nerve tissue in the feet and hands. After 60, blood viscosity increases. Multiple factors contribute to this. Red blood cells become slightly less flexible and have a harder time squeezing through narrow capillaries. Fibrinogen, a clotting protein in the blood, tends to increase with age, making blood stickier. Dehydration, which is chronically under-recognized in seniors, thickens the blood further. And reduced nitric oxide production in blood vessel walls means those vessels are less able to dilate and accommodate slower-moving, thicker blood. The combined effect is exactly what millions of seniors experience every day without understanding why. Poor circulation, cold hands and feet, leg heaviness and swelling, slow wound healing, fatigue that does not respond to rest, and in more serious cases, increased risk of blood clots, cardiovascular events, and stroke. Plain water helps with dehydration, and that alone is valuable. But plain water does not address the fibrinogen problem. It does not restore red blood cell flexibility. It does not activate nitric oxide production, and it does not carry the electrolytes needed for genuine cellular hydration in the aging body. What does address all of these things? What is this one ingredient? It is apple cider vinegar, specifically raw, unfiltered apple cider vinegar with the mother, 1 to 2 tablespoons diluted in a full glass of warm water, consumed first thing in the morning before breakfast. I know what you are thinking. Apple cider vinegar. You may have heard about it before. You may have tried it and stopped. You may be skeptical. I understand completely. There is a lot of noise around apple cider vinegar in the wellness world, and a lot of exaggerated claims that have made serious researchers reluctant to discuss it openly. So let me tell you exactly what the science actually says, specifically about blood flow and circulation, without any exaggeration. Apple cider vinegar contains acetic acid as its primary active compound. Acetic acid, when absorbed into the bloodstream, does several things that are directly relevant to blood viscosity and circulation in seniors. First, acetic acid has been shown in multiple studies to reduce fibrinogen levels in the blood. Fibrinogen is the clotting protein that makes blood stickier and more viscous when elevated. A study published in the journal Bioscience, Biotechnology, and Biochemistry found that acetic acid consumption significantly reduced fibrinogen levels and produced measurable improvements in blood fluidity. Second, apple cider vinegar improves potassium status in the body. Potassium is an electrolyte critical for blood vessel tone, specifically for the relaxation of smooth muscle in arterial walls. When potassium levels are adequate, blood vessels maintain their flexibility and responsiveness to nitric oxide. When potassium is low, which is common in seniors, particularly those on diuretic medications, blood vessels stiffen and become less able to dilate appropriately. Third, acetic acid activates an enzyme called AMPK. AMPK activation in endothelial cells, the cells lining your blood vessels, stimulates the production of nitric oxide synthase, the enzyme responsible for producing nitric oxide. More nitric oxide means more blood vessel dilation. More dilation means better blood flow throughout the body, including to the extremities. A study published in the European Journal of Clinical Nutrition found that regular acetic acid consumption was associated with significantly improved post-meal blood flow measurements in older adults. Fourth, apple cider vinegar has a well-documented effect on blood sugar regulation. It slows gastric emptying and reduces the rate at which carbohydrates are converted to glucose after meals. Blood sugar spikes cause a temporary increase in blood viscosity, and by blunting those spikes, apple cider vinegar reduces how often and how severely this thickening occurs throughout the day. Now, I said there is one mistake most people make that reduces effectiveness by more than half. Here it is. Most people either take apple cider vinegar undiluted, which damages tooth enamel and should never be done, or they take it in capsule form, which bypasses the oral and gastric activation that produces many of its circulatory benefits. Or they take it cold, which slows absorption and delays the acetic acid from entering the bloodstream efficiently. The correct way is this: 1 to 2 tablespoons of raw, unfiltered apple cider vinegar with the mother, diluted in 8 to 10 ounces of warm water. Not cold, not hot, warm. Drink it first thing in the morning, before breakfast and before coffee, on an empty stomach. Use a straw to protect your tooth enamel. Rinse your mouth with plain water after. Wait 30 minutes before brushing. You can also add a small pinch of pink Himalayan salt for electrolytes that support cellular hydration and a 1/4 teaspoon of raw honey for its flavonoids that support endothelial function. These 2 additions make the drink significantly more powerful without adding any meaningful cost or complexity. One important warning before I continue: if you are on blood-thinning medications, warfarin, aspirin therapy, clopidogrel, epixaban, or rivaroxaban, apple cider vinegar has mild additional blood-thinning properties. Combining them without medical supervision is not something I recommend. Please speak with your doctor first if you are on any anticoagulant therapy. For everyone else, this drink is safe, inexpensive, and begins producing measurable effects within 2 to 3 weeks of consistent daily use. Warmer feet, less heaviness in the legs, more morning energy, clearer thinking. These are the results my patients describe when they are consistent. The key word is consistent. 4 to 6 weeks of daily use is where the real difference becomes clear. Not one morning, not 1 week. Consistency is everything with this protocol. Plain water after 60 does not fully address blood viscosity, cellular dehydration, or vascular stiffness. 1 to 2 tablespoons of raw apple cider vinegar with the mother in warm water with a pinch of Himalayan salt every morning before breakfast addresses all 3 simultaneously. Through acetic acid reducing fibrinogen and activating AMPK for nitric oxide production, through electrolytes supporting genuine cellular hydration, and through blood sugar regulation reducing the daily thickening spikes that plain water cannot prevent. Use a straw. Rinse after. Be consistent. Talk to your doctor first if you are on blood thinners. Give it 6 weeks, then pay attention to how your legs, your hands, your energy, and your thinking respond. Your circulation is not permanent. It is not fixed. It responds to what you give it every single day. If this video gave you something valuable today, please do 3 things right now. First, give this video a thumbs up. It takes 1 second and it helps this information reach more seniors who need it. Second, leave a comment below and tell me, have you ever tried apple cider vinegar? What was your experience? I personally read every single comment on this channel and I reply to as many as I can. And third, share this video with one person over 60 in your life who is dealing with poor circulation, cold feet, or low energy. You might genuinely be giving them something that changes how they feel every single morning. Subscribe if you are not already here, and hit the bell so you never miss a new video. I post every single week. I am Dr. Michael Kent. Thank you for watching. Drink smarter, circulate better, live longer. I will see you in the next one.